Now, a recent study published in Public Health Action has shown the impact of the WHO-endorsed Truenat system on TB and drug-resistant TB diagnosis in Nigeria, with implications for the global fight against tuberculosis. Developed and manufactured by India-based Molbio Diagnostics Pvt Private Limited to aid in the diagnosis of tuberculosis and DRTB in remote settings at the periphery, Truenat has reduced turnaround time for TB and DRTB diagnosis, increasing the overall case detection rate and fast-tracked treatment initiation, thereby cutting down the chain of transmission in the communities. And Nigeria has a high burden of TB and is among the 10 countries that collectively account for 75% of the global missing TB cases and 70% of missing DRTB cases. And one key reason for the country's low case detection rate has been limited access to rapid molecular testing facilities. And now we want to find out why these cases are not detected on time and some even go unnoticed. And to discuss this, we're joined by Sumit Mitra, the President, International Sales, Molbio Diagnostics Pvt Limited, and he joins us from Goa, India. Thank you so much, Sumit, for joining us. Sumit, if you can hear me, can you provide us an overview of the Truenat system and how this operates in diagnosing tuberculosis?
Thank you very much, Ibiza. Yes, indeed. Thanks for first having me on the call. The Truenat is a very simplistic, complete start-to-finish solution endorsed by the WHO that has impacted a lot of countries, Nigeria included, in the fight against TB elimination. It consists of very lightweight, battery-powered, infrastructure-independent, two small machines that can report a TB specimen, whether it's sputum, bronchoalveolar lavage, or any other kind of specimen, within 60 minutes. The simplicity of the Truenat or the TrueLab solution, of course, is embodied by the immense amount of science behind it. All these systems are completely connected, and as soon as a positive case is detected, they are immediately reported to the National TB Program's chain of reporting authority, so that right at the first point of patient contact, as soon as the diagnosis happens, the patient can be started on treatment.
Right. And what exactly inspired the Molbio Diagnosis to implement the Truenat system in Nigeria?
First of all, what kind of made us do what we do is because we come from India, and India as a country is resource limited and so on and so forth, and from the global south, etc. So we know the pain points of what it takes to access quality diagnostics. And our brothers and sisters in African countries are no less different, or they don't face any better situation that we do. Unfortunately, Nigeria also happens to be fifth in the line of 10 countries that is responsible for over 75% of the so-called missing million cases in tuberculosis that we have been talking about for years. And that is why, under this USAID funded the introduction of New Tools project, Nigeria was one of the first recipients of the Molbio Truenat solution. And we are very, very happy to have played a part in showing the world the impact of the Truenat solution at the last mile, at the extreme peripheries, where there has always been a disconnect, where there has always been a lack of access to quality diagnostics and so forth. And I guess these are the very, very simple yet realistic reasons why the countries were chosen by the USAID, and Nigeria being one of them. And I am very happy to inform that Molbio is greatly, and it's full of gratitude to have played its part, and will continue to play a part in the years ahead.
All right, Sumit Mitra, President, International Sales, Molbio Diagnostics, thank you so much for joining us and shedding more light on the Truenat system.